And hello, everybody. My name is Karen Russo. For those of you that don't know me, I'm the Dean of the School of Health Sciences. Am also a nurse, so I was originally part of the nursing faculty, and I want to welcome you all to our annual Desmond Tutu Public Health Awareness Lecture. This lecture was founded at AIC after we had the pleasure of hosting Desmond Tutu to our campus in 2010. Reverend Tutu was a key to the anti-apartheid movement in South Africa and worked really hard to support human rights for all. He believed you should do a little bit of good where you are. It's those little bits of good put together that overwhelm the world. He was the recipient of the Nobel Peace Prize in 1984. Since the time of his visit, we have held an annual public health presentation to raise awareness around the pressing health issues and health disparities, as well as the work that is being done to address these needs in our region, our state, nationally, and this year globally. This year, through the generous support from the Office of Government and Community Relations at Bay State Health, AIC is proud to present Dr. Norbert Goldfield, a physician at the Brightwood Riverview Health Center in the north end of Springfield. Dr. Goldfield is the founder and CEO of Healing Across the Divides, or HATD. This organization is focused on peace building through health in the Israeli-Palestinian areas. For over 20 years, their mission has been to improve the health of marginalized Israelis and Palestinians through community-based interventions. The organization has funded more than 40 Israeli and Palestinian community groups, measurably improving the lives of over 200,000 marginalized citizens. And they have brought community groups together wherever possible. He's also published more than 100 books and articles, including his recent book, American Fragility in a Pandemic Era, Public Health, Public Trust, and the Role of Health Professionals. In the 20-year history of Healing Across the Divides, the work has never faced the levels of violence and upheaval they are facing now, and it profoundly impacts the work that is being done. HTAD is one of the few organizations treating emotional and physical well-being of communities impacted across the divides. After hearing the presentation, please visit their website, healingdivides.org, to learn more of all the wonderful things that they do and consider supporting this ongoing work. And now, let me present Dr. Goldfield.
Can everybody hear me okay? Thank you, Karen, for that wonderful introduction. I want to give a few thank yous to get started. I want to, first of all, in addition to Karen, I want to thank Fred Hooven, Mike Maresca, who's on the doing all the technical stuff, which clearly I would never be able to do. I want to thank my colleagues at Bay State Health, including Mark Kerouac, the CEO. I want to particularly also highlight Keo Jones Santiago, who's one of the Brightwood people that I work with, who's just wonderful to work with. So it's great that we're all tying this together with people, wonderful people like Keo, to be here. So, and I'm told that Jorge might come also, but these are some of the people, the wonderful people at Brightwood and at Bay State Health that I work with, and I want to express my appreciation to Bay State Health for their support of this lecture. Today, what you'll do is you'll hear from me briefly, about 15 minutes. You will then hear from the West Bank from Nihat Fatah. You would have heard from Veronica Bigdorchik, who's our Israeli representative. Nihat Fatah is our Palestinian representative. But unfortunately, Veronica, for family reasons, could not attend today. Then there will be some concluding remarks. So what I'd like to do is really emphasize 3 points, and I'm going to expand on them. I'm going to, in probably an embarrassingly short way, summarize the conflict in about 3 or 4 minutes. And this conflict is, this war between Israelis and Palestinians has been going on for more than 75 years. So I'm going to do it in a few minutes. Then what I'm going to do is I'm going to talk a little bit about Healing Across the Divides and use my most recent trip. So I came back on Sunday from the region, and I'm going to use my recent trip as a vehicle, as a way to sort of get you into the feeling of what it's going to be, what it was about, and what the work is about. And then lastly, I'll make some concluding remarks, but between that and after my discussion about healing across the divides, I'm going to turn it over to Nihat Fatah, who will be speaking from Ramallah, which is the capital of the West Bank, and we'll be talking about her role and her work at in healing across the divides. So first of all, this like I said, this embarrassingly brief history. So just to lay it out there was a land of Israel. Some of you have looked at the Bible, even if you're not religious, you've heard of the Bible. There are people who are not religious who talk about the Bible all the time these days. So at the time of the Bible, there was the land of Israel, which was approximately 2,500 years ago, destroyed by the Romans twice in approximately the year 70 and the year 130, so 2,000 years ago. Fast forward to 1453, between 70 AD and 130 AD and 1453, there was a combination of the Roman Empire that slowly transitioned over to the Byzantine Empire, which was eventually controlled by the Muslims, and that was the Ottoman Empire. They took over in 1453, okay? And that included all the land of Israel and all the Middle East, okay? Fast forward from 1453 to 1919. 1919, the Ottoman Empire collapsed. They are on the losing side of World War I. Not World War II, World War I. So the Ottoman Empire collapsed. The victorious side, which is basically the British, the French in particular, divided up the Middle East, and Britain took over what was called the Mandate of Palestine. Fast forward to 1939, the World War II started, and certainly one of the most important events in Jewish history, if not the most important event in Jewish history, was the Holocaust, where 6 million Jews were killed. After 1948, the land of Israel was, the independent land of Israel was established, and immediately there was the first War of Independence, where Arab armies invaded and lost. Several wars since then, and we still do not have peace. And we're farther away from peace today, as far as I'm concerned, than it's ever been since 1948. So we're living in very perilous times. So what I tried to do is really give you kind of a sense of the facts, but I just want to also give you a little bit of a flavor. And for Palestinians in the occupied Palestinian territory, Arab countries and Palestinian diaspora, millions of Palestinians left what is now called Israel and left to the West Bank, to Jordan, to Lebanon, to Egypt, to Springfield, Massachusetts. Palestinian diaspora, the loss of Palestine, figuratively their own paradise, was both displacement and replacement by, from their perspective, an invading hostile group. Reversal of this traumatic reality is very difficult and currently unattainable. In contrast, Israeli Jews and most Jews throughout the world see the establishment of the state of Israel on the exact same land. These are, at the end of the day, two nationalisms that are competing over the exact same land, as in part a religious or secular fulfillment of the land of Israel, inhabited by Jews for thousands of years. The biblical idea of the promised land, together with ongoing European anti-Semitism, gave birth to the Zionist movement at the end of the 19th century. So Zionism was a movement that encouraged the idea of, quote unquote, settling the land of Israel with Jews. However, to many Israeli Jews, the Holocaust or Shoah represents the primary event in the formation of Israel. So I'm trying to also not just give you a set of facts, but try to give you a flavor. And I was asked this question already earlier today: what motivated me to start Healing Across the Divides? What motivated me was the fact that I'm Jewish, my parents are Holocaust survivors, and I feel that I have to do something that's concrete about what's going on in this war, this interminable war. And since I'm not one of the 10 or 15 people, and there are 10 or 15 people in the world who could make a difference from the top down, what I know is communities. What I know are health. I work from the bottom up. And that's why I started in 2004, Healing Across the Divides. Our mission is to measurably improve the health of marginalized Israelis and Palestinians via community-based interventions. As Karen pointed out, we have funded at this point more than 50 community groups, and we are currently funding 10 groups in Israel and in the West Bank. We were funding a group in Gaza till about a year ago. It was an intervention which I'll describe in just a second, just to give you a flavor of what's happened to him. His apartment was destroyed in the ongoing bombing. His sister and her whole family were killed. He was able to escape to Cairo, and he's currently in Cairo with his family. So right now we're funding 10 groups. Our midterm hope is to, in addition to working with these groups to measurably improve the health of marginalized Israelis and Palestinians, is we work, as I work in the north end of Springfield, as Keo knows, we work together to try to improve the health of the north end of Springfield through a variety of ways. And similarly, we try to work with these community groups to improve their own capacity and to improve the leadership potential of the people, the amazing people that I'll describe to you more in just a minute, of these 10 community groups that we're working. Long term, my dream, and it's very likely just a dream, but that's okay. I have to have a start with dreams, and then I try to deal with reality. My dream is some of these leaders of some of these groups, they're amazing, could be tomorrow's political leaders. And they're the ones who are going to make the peace, not me. I'm going to work on issues via Healing Across the Divides of improving health. So let me give you a snapshot of the work that we do here. When I say here, it's not here literally, but here, there, in the West Bank and Israel. So on the first day that I was in Israel, and then I moved over to the West Bank, but the first day I was in Israel, we always fund one community group that has nothing to do with a conflict. So it seems paradoxical. What do? We are funding a group that's trying to improve the health of refugee asylum seekers. We know, and Keo knows, that we know about the undocumented workers, and you all, I'm sure, have heard about the undocumented in Western Mass and throughout the United States. That's for sure. These individuals have even fewer rights. There's approximately 80,000 that came from Africa, from Sudan, Eritrea, and Ethiopia that came and made their way to Israel. There are about 30,000 left. They're completely stateless, have virtually no rights. And we met with one group that we're funding. We always fund one group to try to improve their health. And these are of Sudanese people in the southern part of Israel. And they're working on issues of sexually transmitted diseases and issues pertaining to their emotional health. One man, just to give you a flavor, one of the leaders, and these people, again, are just amazing. He was telling me how he would love to be able to go to another country. He's been in Israel for 12 years. He has no chance of getting married, no chance of having children, and would love to find a third country that's willing to take him. So it's gone from about 80,000 to about 30,000, but there's still 30,000 what we call refugee asylum seekers in Israel. And we always fund one group. Another group that we fund is on the second day. So we went and visited two grantees, brand new grantees. One of the grantees is pertaining to Arabs who live in Israel, or Palestinians who live in Israel. About 20% of the population in Israel is Palestinian or Arab, of which a fair percentage of whom are either, they call themselves Palestinian or Arab or Bedouin. They're extremely poor, have live in what are called unrecognized villages. Here in Springfield, if you've got the money, you go buy a house and you can just make your house. No problem. You can't do that in Israel. If you're a Bedouin and you live in an unrecognized village, you get no services whatsoever. You can't just hire a contractor to get a septic system put in. So we fund one group called Al Bakur that's working on early childhood literacy using an evidence base. And that's what our work is. We try to encourage all the different community groups that we work with to adopt evidence-based approaches to the efforts that we're considering. And so they are implementing an effort pertaining to literacy with early childhood in the southern part of Israel. Another group, and then I'll move to the West Bank, that I'd like to highlight. Another group is a reproductive rights group in Jerusalem, where Jerusalem has been taken over by Israel, and they've declared it as the undivided capital of Israel. Yet West Jerusalem is mostly populated by Jews, East Jerusalem mostly populated by Palestinians, and there's a reproductive rights group that's working between Jews and Palestinian women to try to both work on issues of sexual education for Palestinians living in East Jerusalem and issues of reproductive rights for Palestinian women, in particular in East Jerusalem. It's an effort to have people working together, and they talked about when we met with them how the fact is that it's very difficult initially in terms of how are we going to communicate with this ongoing war that's going on after October 7th. What's amazing, and what I'd like to kind of emphasize to you and highlight with you, is the fact that since October 7th, since the attack that killed over 1,000 Israeli civilians, I want to emphasize that the groups, and that was thing that was most amazing for me, is that people are holding in two hands. On the one hand, a sense of horror of what's going on in the war, and at the same time, they're not giving up. They are redoubling their efforts to do the work that they're doing, and that was absolutely in evidence when we met with this group called Ladat, working on reproductive rights. Similarly, when I went to the West Bank, so just so you get a flavor, going from Jerusalem to Ramallah is about 10 miles away, less than a third of going from here to Northampton. To go to Ramallah from Jerusalem, I take a bus. There's a wall, a huge wall that I have to get off. I get off the bus, walk through a maze, walk through all sorts of turnstiles, get off on the other side, and then take a minibus to go to the downtown Ramallah, where I met with Nihat Fatah, who's our Palestinian representative, to meet with two of our grantees there. That whole effort, just so you get a sense, that 10 miles took 2 hours to do, not a short trip at all. Yet, when we went to the school and we went to meet with a grantee called Palestine Sports for Life, they work in a refugee camp. So remember, I said that there were hundreds of thousands of Palestinian refugees that fled from Israel after the 48 war. They went all over the world, including to the West Bank. And there are a number of refugee camps in the West Bank, including the Al-Amari refugee camp, where Palestine Sports for Life, led by an amazing woman named Tamara, what they do is work on issues of sports and nutrition. We met with some of the participants, both teenagers, young adults, mothers, and they spoke glowingly. Just think about this. For those of you who've gone to eat the school lunches that you've had in the past, they spoke glowingly as to how they were able to change the menu that was being provided by the school in terms of lunch, to have something that was nutritious. They spoke glowingly how the exercises that they were engaged in throughout the camp and bringing back home. That's something that was amazing. As I said, and I'll read this to you right now, is in thanking all the Palestine for Life participants at the conclusion of the meeting, I emphasize that each and every one of them, ranging from school children to middle-aged mothers, could be tomorrow's political leaders. And that's what we do. We want to increase the capacity of the group. We want to see some of them rise for the stars to dream their dreams and achieve it. But at the same time, since I come from a science background, I want to see measurable improvement in health. One last grantee before I give the floor over to Nihad is I want to say one grantee, and then I want to highlight one aspect in conclusion of this section of the discussion. And by the way, before I forget, I'm hoping that all of you are thinking of questions, the most challenging questions that you can come up with, so we can have some discussion, because there will be time for questions afterwards. So we went from Ramallah, we went by car to Bethlehem. Remember Bethlehem from the Bible? It's there, you know. So we went from Ramallah to Bethlehem, another 10 miles, another 2 hours, another set of checkpoints. But we made it. And we met with the head of a new program that's working specifically with issues of people, of young Palestinian, either children or mothers or teenagers or young adults who've been arrested and or has suffered violently over the last years and have mental health issues as a consequence. So these people, many people within the West Bank and Gaza, they're not talking about post-traumatic stress disorder. This is ongoing stress disorder that is occurring. So what they're doing is they're implementing a program called that's basically focuses on look, listen, and then link if they need to have additional services, mental health services, over and above the services that are being provided. What's remarkable about this program is that they are doing a train the trainer program. So train the trainer programs are very much, as we begin to wrap up, very much the kind of work that, for example, that I do at Brightwood. I saw a patient yesterday, a diabetic yesterday, whose diabetes was very poorly controlled. I'd worked with him for a long time, and I basically was trying to encourage him to think about my not being his doctor, but rather my being his assistant. And Keo knows all about that. And that he should take charge as much as possible of his life. And in fact, his diabetes, which went from very poor control to now very good control as of yesterday. So what we're trying to do through health in Healing Across the Divides, and this very much has its parallels in the north end of Springfield and throughout humanity, is the whole idea of empowering individuals to take care of themselves as much as possible. So through this, now I'm going to give Nihad a 1 minute time check so that she's going to be on in 1 minute, which is to say, I want to describe to you 2 photographs. And the first photograph is a photograph that I'm sure many of you have seen, or photographs that many of you have seen, of the Israeli hostages. They're flashed all over the TV all the time. And when I was in Israel, I saw them everywhere. What was very moving is to see these huge posters, groups of photographs of Israeli hostages, and with the headline both in English and in Hebrew, bring them home. And there's very much a divide within Israel as to how to do that. For sure, within the West Bank and in Gaza, there's mourning going on. But photographs are not as in evidence. But when I went and I was waiting for Nihat Fatah for her in Lion Square, I saw an amazing, huge poster. And it says, read it says, "We are not numbers." The photographs were of children who've been killed in the Gaza war, and had photographs, portraits of approximately 100 of those. So we have different ways of showing the traumas. Those photographs will never mix. But when I conclude, after Nihat speaks, I'll talk about what I think is possible over the near term and how we can bring these peoples together. But today, the war is going on. So Nihat, you're on, and we're going to switch to a photograph, and I'll sit down.
Hello, my name is Nihat Fatah, and I am the Palestinian representative. I moved to Palestine about 20 years ago with my family. I have 3 boys, and started working with Healing Across the Divides in 2015, basically managing the small grants in the West Bank. And in Gaza up until recently. I just wanted to say a few things first about what Norbert mentioned, which was about Palestinians leaving. Palestinians did not leave Palestine. They were forced when the state of Israel, were forced out when the state of Israel was created. And just a reminder that Palestinians have lived in Palestine for centuries. So this is home to 5.5 million Palestinians in both the West Bank and Gaza, and 2 million Palestinians who are living now inside Israel. So I just wanted to clear that up, because there is a lot of history here for us in this region. As Norbert said, we are currently working with 5 organizations. Norbert mentioned Palestinian Sports for Life. They're an organization that's actually based in Ramallah. And currently they are working in 2 camps, one in Ramallah and one in Nablus, providing education on healthy eating and using exercise as a way to make you healthy, and also to help with help you relieve some of your psychological stress. What was interesting about our meeting on last week when Norbert was here was that the mothers are also heavily involved in this program. And what we've learned within our programs is that we need to focus on working with mothers, because they are the ones that run the household. And all the women there mentioned how they started to change how they eat and how they've incorporated exercising into their programs for their whole family. So we don't just have direct beneficiaries for our programs, we also have indirect beneficiaries. And in this particular case, it was women and their families. They usually work, all their work is in UNRWA, UN-run schools, and that's where they provide these services. The other group that we work with is called El Majd for Community Development, and they are in Jenin, in the Jenin area, Jenin currently, and has been prior to October 7th, have been experiencing daily incursions by the Israeli forces, where there has been many people killed and homes and destruction before October 7th and since October 7th, which has not stopped. Their program is called Healthy Children, Healthy Future, and they focus on providing community services to women and youth and children. Their primary focus is providing psychosocial support through art and drama therapy. However, since October 7th, since it's been so difficult for them to come together, they've started to do individual counseling with young children. There's been a huge need since October 7th. So their major focus right now is doing individual counseling. ANAR for Empowerment and Psychosocial Support was the group that Norbert just spoke about. Look, Listen, and Link. They're an amazing group also who is working in Bethlehem and in Hebron, and most of their work is also in the refugee camps. Our next program is called Youth Organization, Tomorrow's Youth Organization, sorry, and they're based in Nablus. And then their program is called We Deserve More. The objective of this program is to transform social norms about prevalent issues faced by women. The primary focus is on gender-based violence, followed by a women's right to education, prevention of early marriages, and what it means, and a women's right in a marriage. So they're using storytelling activities and community discussions to address these social norms. They're also planning to produce a short film and share them with male cultural leaders in the areas that they're working at to help shift the social norms and to help men be a part of change in their communities about the roles of women. I have two last groups. The next group is Yes Theater. They're a organization based in Hebron, and they're doing work in an area called Masafariyata. Some of you may or may not have heard of this, but there's an area called Susia, but that whole area right now is being tormented by settlers, settler violence in that area, which is in the West Bank. And so Yes Theater provides psychosocial support through drama and art therapy. That's a group. And then our last group is actually a joint group working, it's called Diabetes Palestine, and they're based in Hebron. And we're working with a Palestinian group inside Israel called Ajwan. And that group is working together to provide awareness and support for people living with type 1 diabetes. They'll be doing work together, including training of trainers and community activities to bring awareness on how to manage your diabetes, and if you're pre-diabetic, how to try to avoid getting diabetes. So this one's also an exciting group for us because it'll be Palestinians living in the West Bank working with Palestinians living inside Israel. I think that's all I have for the groups right now. So I think back to Norbert or whoever else. Thank you.
Thank you, Nihad. And first of all, I want to express my appreciation, Nihad, for the many years that she's worked at Healing Across Divides. And secondly, I appreciate one thing that's really great about the staff at Healing Across Divides, that we're able and willing to correct each other. And I appreciate Nihad's correction of my misstatement with respect to the what is called the Nakba, or the expulsion of Palestinians from Israel. So I'm hoping again that you'll have lots of questions, but I want to make some final concluding remarks. I'd like to start out with what Desmond Tutu would say, and in fact did say. So I'm going to quote from 2 points that I researched when I was looking up his stay here at AIC and some of his other statements regarding the conflict in the Middle East. But in general terms, and here I quote, and just think about this yourselves, in terms of your own lives, your own families, your own communities. Violence begets violence and hatred, and that only begets more violence and hatred. We also know the benefits that dialogue between our leaders eventually brought us. And here he was speaking about between de Klerk, who was the head of the South Africa at that time, who released Nelson Mandela, who had been in jail for 28 years. And we also know the benefits that dialogue between our leaders eventually brought us. When organizations labeled as terrorists were unbanned, and their leaders, including Nelson Mandela, were released from imprisonment, banishment, and exile. And here, in many ways, Archbishop Tutu was talking really to Israelis in particular, trying to encourage them to really reach across the divides and to find ways of bridging divides. Continuing with Desmond Tutu, we know that when our leaders began to speak to each other, the rationale for the violence that had racked our society dissipated and disappeared. Acts of terrorism perpetrated after the talks began, such as attacks on a church and a pub, were almost universally condemned, and the party held responsible snubbed at the ballot box. Continuing, the exhilaration that followed our voting together for the first time was not the preserve of Black South Africans alone. The real triumph of our peaceful settlement was that all felt included. And later, when we unveiled a constitution so tolerant, compassionate, and inclusive, it would make God proud. We all felt liberated. And lastly, before I turn to my concluding remarks, he says, of course, it helped that we had a cadre of extraordinary leaders. We don't have those leaders in Israel and Palestine today. They just simply don't exist. My concluding comments are as follows. Other than the obvious ongoing horror about the situation shared by all our staff in Israel and Palestine, I'm simultaneously moved, and I hope you were moved also even a little bit. It really makes a difference when you're there, I can tell you for sure. But I was simultaneously deeply moved by the desire to live. People just want to live, folks. We all want to live and have a little bit of hope and make a measurable health difference as we at Healing Across the Divides are doing. But I want to acknowledge one thing. And for those of us who have no hope, there's the human desire to live, especially as we enter springtime and make an impact on other people's lives, as our both extraordinary staff and grantees are doing each and every day. And what does that mean specifically for all of you here in the audience today? And now I'm going to end up by quoting again Archbishop Desmond Tutu. And this is what he spoke about, and these are his words when he was here at AIC. And think about this, and think about what you can do individually and within your family about what Archbishop said. We think a little more reconciliation, and this is in 2009, is that correct? 2010, 14 years ago, which seems like it was peacetime back then. Just think about today here in the United States. The Archbishop said, we think a little more reconciliation and less rancor might be in order for American politics today. But all of you have a part in it. All of you, each and every one of you. The question is, how can we work together? What I tried to do and what Nihad tried to do is give you a little bit of a slice and a sense of what we're trying to do in a war-torn part of the world. So I want to, first of all, again, say thanks to Karen, thanks to Fred, thanks to Mark Kerouac and my colleagues at Brightwood, including Keo. Appreciate you all being here. And we have time for some questions, and I'd like to stop.
I wonder if you could talk about the similarities in some of the work that you do through Healing Across the Divides and what you see can be done in the community, say in the North End, and some of the work you do with Brightwood.
So that's the key question. And at the end of the day, there are two ways to looking at it. Number one is at the micro level, and I gave you an example of the micro level of the diabetics that I saw yesterday. Let's build that out a little bit more. Certainly Brightwood as an example and Bay State as a broader example, and we all need to do this in Springfield. We need to work regularly from a public health perspective as to how we can address, and then I'm going to give you a concrete example, how we can address the many health disparities that exist, the differences between rich and poor, between men and women. So I'll give you two quick examples. We've implemented in the West Bank, and we're about to implement in Israel, working with Palestinians, a program that was developed at Stanford and translated and validated in Arabic called the Chronic Disease Self-Management Program. It's exactly what it sounds like. It is lay-led, and it's been implemented in millions of people throughout the world. Millions of people throughout the world, including Western Mass. So this chronic disease self-management program, which is the epidemic of our lives. So diabetes is the epidemic. COVID, in many ways, was the epidemic and can come back for sure in terms of acute illnesses. But the epidemic that hangs over us is what we can, is our chronic diseases. We've implemented the work with about 5,000 Palestinians. Diabetes Palestine, based in the West Bank, together with Palestinians in Israel in Nazareth. Remember Nazareth in the Bible? It's all there, let me tell you. All those towns are still there. And so we're trying to bring them together, and having Palestinians in Israel, having Palestinians in the West Bank work together on using this chronic disease self-management program to implement. And whether it's this program or many other programs, these are the kind of initiatives working with community groups that I believe should be lay-led as much as possible, not doctor-led, not nurse-led, but where we empower individuals working with their families and communities to improve health.
I know your mission is focused in is the Israel-Palestine area. Do you see it expanding maybe in the future to other places around, or would that be in other groups kind of?
Good question. So the answer is no. We have enough to do with where we are, in case you haven't heard. And I think there's always an organizational tension, and I know of other groups that, and I can tell you that the October 7th was a rupture like has not happened since 1948. And so a lot of groups that are working together in whichever ways, they're having a great deal of difficulty. But I think what our strength is, and we have a board member, and I want to highlight the president of our board is actually in the audience, so I want to thank him for that, Morty Kamel, is that we have on our board, we have Jewish Americans, Arab Americans, we have evangelicals, we have Americans who are interested in the conflict. That has to be our focus, because even if by some miracle, and let's believe it, right now there's a war going on, that there's some kind of resolution that could be addressed over the coming months. The reality is, as you already know just by seeing the pictures, is there's going to be an incredible amount of work. I can tell you for sure that as Archbishop Desmond Tutu talked about, that violence begets more violence. I can tell you that the hatred on both sides, with extremists on both sides, has only gone up. So we will stick to our knitting from a management point of view and stick with the area, while I have the honor to have been at Brightwood since 1989, before almost all of you were born. And I will continue to work there, and to work there within the North End community as a wonderful pleasure. Thank you for that.
Thank you. I've got a couple questions from online. There are, I can't see it anymore. There are about 40 people online, 50 people online. Are there other organizations that similarly try to encourage real collaboration between Israelis and Palestinians?
So there's an organization of which we are a founding member called the Alliance for Middle East Peace. And it's about 100 organizations that, to make it simple, as I've already alluded to, is under tremendous duress. Right now, when there are meetings, the Palestinian groups, by and large, meet with just Palestinians on the West Bank, and the ones within Israel meet amongst each other. So they do exist. It is my belief that, and again, here I'm speaking personally, I'm not representing the perspective of Healing Across Divides, that the United States almost never does a correct move in the Middle East, almost never. And what they insist on, for example, I think is completely wrong. They insist on Jews and Palestinians working together today. Well, guess what, folks? Today is not a great time for Jews and Palestinians to work together. It doesn't take a rocket scientist to figure that out. So I just finished an article that made that point, that we should not be insisting that Jews and Palestinians work together. But in fact, unfortunately, USAID, the United States Agency for International Development, prefers only that type of effort to go on. Whereas I believe that we should have, for example, the program that I just alluded to, where Palestinians in Israel and Palestinians in the West Bank, work together. But there is an organization that called the Alliance for Middle East Peace that does that kind of work, and is an umbrella organization, frankly, I meant to say, and there are about 100, but they're under tremendous duress now. But the reality is, I can tell you right now, I don't know when it'll be, but the fighting will subside, and there will be people like Nihad, like Veronica, who unfortunately could not join us today, our Israeli representative, because she had a family emergency, and they're talking with each other, they're communicating with each other. I had supper with them and Tova Resnicek, our communications director. We had supper all together. That will continue and that will expand after the war subsides.
This might be a good follow-up, or maybe you answered it. Even before October 7th, your grantees, Palestinian and Israeli, did not work together even for medical and social issues. Why? And why do you think this can change after the horrors of this war?
Good question. So the situation was getting worse before October 7th. So we had joint grantee meetings till about 2019. And interestingly, and when I say joint, I meant people from the West Bank would come from East Jerusalem. And could I trouble you for the cup there? I'm sorry. Try not to use plastic, so I bring my own cup. They used to get together, both Israeli and Palestinian, in East Jerusalem until 2019. Interestingly enough, neither side would want it to be publicized because they were afraid of being harassed by their own populations. But they were wanting to meet. And just to give you one anecdote, we used to fund a farm, and I am not a farmer, but we funded a farm in southern Israel, that was working on issues of nutrition between Jews and Palestinians in southern Israel. And at one of the grantee meetings, they met with a women's group from Nablus, which is in the northern West Bank. So this is southern Israel with the northern West Bank, all together about an hour and a half away. And one of the women from southern Israel came up to me afterwards and said, I had this long conversation with this woman from Nablus. And I can just tell you that if it wasn't for Healing Across Divides, I would never have had a conversation with a woman from Nablus about issues of any point. In this case, they were talking about domestic violence. But just the idea of having a conversation with somebody from an hour and a half away, which seems light years away. So that did go on. But the reality is, before October 7th, the situation was getting worse. When Nihad talked about settlers, Israeli settlers, I want to clarify what that means. That means there are about 750,000 Israeli Jews who are now living in the West Bank in settlements that are technically not recognized by the United States, but the United States never does anything about that. So basically, the West Bank is divided into parts, some of which are lived in by Israeli Jews who've moved to the West Bank, and then also by Palestinians. So settlers, since October 7th, are ramping up their attacks on Palestinians in, for example, one of the areas where we have a grantee. But the but the reality is, unfortunately, even before October 7th, those connections were fraying at the edges. And so what we do today, we always ask the question, and that's why we have a representative in Israel and a representative in the West Bank. We ask the question, what can we do today that's concrete, that's measurable, that improves people's health, and to the extent that it's possible, brings people together? That's what we can do today.
I understand that Brightwood has a very unique public health model that is recognized across the state. Are there other health clinics in Massachusetts that use your model in terms of integrating the community and or expanding their work throughout the world?
Unfortunately, or fortunately, I'm a clinician at Brightwood, but I want to highlight one program at Brightwood. So as you can tell, since I've been there for 35 years, that I like working at Brightwood. It's a great place to work. And I encourage people to, to consider coming over and checking us out. But I want to highlight one program in particular. So that was, so when I leave, when I go, we do take vacation. This is my vacation. So there's coverage. And one of the doctors that was covering for me was Dr. Tom Lincoln. And Dr. Lincoln is a physician there's only been one physician who's been there longer than me, and that's Dr. Jeff Scavron, who I'm sure some of you or many of you have heard of in the community because he's very community involved. He actually lives like 4 blocks away from here. And Tom started a program at the jail, at the Hampden County Jail. And that program, which basically tries to have transition of care after, where so we have practitioners at the jail and practitioners at the obviously at Brightwood, but we see them seamlessly when they are released from incarceration. That program has been very much a model for reproduction. There's lots of other groups, and if Kia wants to tell me about any of them, no. Oh yes, thank you. I'm telling you. See my brain. But see, that's why we work together. Kia and I work together as a team. So we have a farm worker program. So we have a program that was started by the late Dr. Marty Nathan, who was a very much active. Some of you probably heard of her, an activist on climate issues and an activist on a whole range of issues, called Cliniquita, and where we have on site community health workers that work with a very large undocumented population that lives in the greater Springfield area. We call it the farm worker program, but many of them are not farm workers. They are workers in Springfield. They're like, I'm sure some of you read that the bridge that collapsed in Baltimore, at least one of the people there was undocumented. One of the people who died was undocumented. Similarly, with respect to what we call the farm worker program, which I believe is a model, and it's an amazing model, and where we provide care at the camps. I've gone out myself. We've gone out to these farms, and so we do outreach. And in addition, we have community health workers that go out and provide services. Thank you, Kia. Teamwork, if there's nothing else that I'd like to emphasize, is communication, 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 and then that'll beget more teamwork. Yes.
So we've got just a few minutes. I've got 3 questions. I'm just going to go in order here. How do you vet, interview, and retain such dedicated, talented, sensitive, caring talent for your Healing the Divides teams? That did not come from someone who works with you.
Are we talking about staff or? Oh, well, as you heard from Nihat, she's amazing, right? I mean, she's an amazing woman. And, the pressures, she didn't speak about it, and so I'm not going to speak for her about it. But the pressures that the staff are under are just horrendous. I can tell you right now. There's great deal of difficulty. And I'll say, and I've said this before, the one thing, in addition, that I'm very, very appreciative, and it goes back to communication, just like Keo and I just did a few seconds ago. I'm so appreciative of the fact that Nihat and Veronica communicate with each other, because without communication, there can be easily misunderstandings at a time of war. This is war right now. So I didn't highlight one other person, Tova Reznicek, who's our communications director. She's been with us for 12 years. We're a very small organization. They're all part-time. We do what we can. We do great work, and we're just appreciative of what we can do. Another couple questions? Well, I want to thank again Karen, Fred, Mark Kerouac, Keo, everybody, and most importantly, yourselves for coming. Please think about what is it that you're going to concretely do, not tomorrow, today, in terms of reconciliation. Thanks for coming.
I want to thank everyone for coming, and I want to thank the Sci-Tech students that joined us this morning too. For those of you that didn't realize, we have high school visitors in the back, and thank you all for attending.